Hi, Gill, it's Lee. While we're waiting for people to put their questions up, one that often comes up is, can colostrum assist with high-performance athletes?
Hi, Lee. Yeah, absolutely. There's a lot of studies that leverage from the natural growth factors, which encourage muscle recovery, and also the growth factor proteins, which help keep away the high performance exercise inflammation from the body system. So basically, high performance sport causes inflammation throughout the body, and it is shown in many studies some benefits that taking colostrum after the high performance. So in athletes, but obviously that relates to other people doing sport of any kind, to be honest. If I can take a question off the chat. So how colostrum can be better for immune protection compared with human colostrum. So basically, unlike humans, and I mentioned it in the seminar, humans give immunity to the infant through the placenta. That's not the case in ruminants such as cows. So basically, the calf is born with no immune system whatsoever. So the role of the colostrum is to give a much more complete pre-formed immune system to the calf than humans need to do. And in this way, therefore, bovine or cow colostrum is much richer in pre-formed immune substance than human colostrum. There's another question up from Roman. So, is orally taken colostrum protected from digestive enzymes? It is actually, because the colostrum is a complex food substance. There's lipid, fat, and lots of other proteins in a serving of colostrum, and they're all together like in a little grain, like lots of little grains. And the presence of protein and lipid naturally protects the immunoglobulin, for example, from digestive enzymes in the stomach. But then also immunoglobulins are designed by nature to be a bit more resistant to digestive enzymes than other proteins, like, just muscle, like a steak. So an immunoglobulin is an immune protein, so it's a bit less susceptible anyway. So this is a good question. Can colostrum be used for topical infections and wound care? Actually, yes, it can. And I personally had a major wound, and I did a private study and showed, if I did colostrum bandages on my very, very injured shins, that the skin would heal. And it did. And I took photographs. There's a lot of evidence in horse fetlock wounds, again, putting colostrum in bandages. This is in a veterinarian application. And what we're looking for is no infection, rapid reformation of the skin that has been lost. And I think it's an emerging field, getting colostrum into topical wound care. So this is from Richard Long in Nigeria. How can colostrum help people with HIV and TB, that being tuberculosis? The interesting thing about HIV is that it hides in the gut. So taking colostrum, and we know that boosts gut health through inhibiting viral and bacterial unwanted microbes that might reside there. that's just one example of how colostrum might work. But there are studies in HIV-infected people that also colostrum has a positive effect on the incidence or severity of the tuberculosis, which is one of the co-diseases with HIV. Sorry, just allow me to read down. A lot of questions have come in. This is just a relevant one for anyone thinking about using colostrum to see how it goes in somebody that might have an unmet need. It's a food, so it's not a drug, so it's always going to be safe. I'd like to emphasize that. Giving colostrum to an 11-year-old who has Prader-Willi syndrome, I don't actually know that syndrome, but the best way is to, I think an 11-year-old could swallow colostrum capsules, but if not, just sprinkle it into something that's cool, like a glass of milk or something, not in hot food, but you can just sprinkle it on whatever you feel like. Yeah, Graham's just replied as well. Yeah, external use capsules, yes, you just take the pure colostrum and open the capsule and you can put it onto a plaster or a little bandage, which is what I did. I was making a colostrum paste in tap water and just smearing it on a bandage. This is another relevant one from Soraya, Newcastle. Yes, the role of estrogen hormone-positive cancers, in this case estrogen-positive breast cancer, and the impact that colostrum might have, because colostrum has increased hormones and is affecting her thyroid. We know that ingestion of colostrum has no influence whatsoever on any peripheral hormone signaling. Colostrum doesn't contain preformed estrogens. They're destroyed by the natural hygiene treatment, so the pasteurization of the colostrum. The main benefit of colostrum is for gut health. There's no evidence that anything in colostrum gets into the peripheral circulatory system and has a negative or a positive impact. It's all through the gut immune system in the majority of cases. So the other point on that is 1 or 2 grams a day is what we're looking at. I do know that some doctors advise that people with hormone cancer shouldn't take dairy, but in that case, they're talking hundreds of mils of milk, for example. So 1 to 2 grams of colostrum, which is mainly immune system, should be perfectly safe. But obviously, it's a discussion to have with the clinician in charge. Another one from Celine Ko in Malaysia. So how can colostrum help people with stomach cancer? That's actually a really interesting question. I think there's a lot of benefit for colostrum to be used alongside other treatments, because obviously when a cancer is already present, it might have gone to the stage beyond natural repair. So something stopped working in the early stage. But definitely looking at colostrum and the lipids it has and even all the non-specific antibodies, they're actually anti-inflammatory. There's growth factors that can help fight the lesion in the stomach. And again, it won't cause any harm whatsoever. Some of these interesting cancers, it still remains to be seen in proper clinical trials and identify a formal positive impact. But there is a lot of anecdotal data for colostrum assisting with all gastrointestinal cancers, so that's stomach and all the way through the digestive tract. From Lara, can colostrum help with dairy allergies? There's an interesting paper I was reading just last week about peptides in colostrum having a anti-respiratory allergic effect for dairy, and so gastrointestinal allergy. Again, colostrum mainly is immune proteins and does not deliver enough of the allergic milk proteins. That's the caseins that you might have heard of. So again, dose and composition of colostrum, I would definitely say that a dairy allergy person could take that, and they might see a benefit actually to dairy. I can't see any more new questions. Anyone has any more? Okay, here's another one from Shamima. Reads that someone is on dialysis, so they've got kidney disease, and indeed in people with kidney disease on dialysis, worried about calcium and potassium buildup. So again, this goes back to colostrum isn't milk. So those questions actually are more relevant to high volume consumption of dairy. Colostrum isn't dairy, again, 1 to 2 grams a day. Yes, it does contain calcium and potassium, but a tiny amount compared to what's in milk. And so again, yes, I would agree there's no risk for somebody on kidney dialysis from taking colostrum. Nick Hafiz, does lactoferrin contain any antiviral properties? Yes, it absolutely does. There's an increasing body of science that directly looks at that property, and that's because in some manufacturing lines in dairy factories, the lactoferrin that's even in milk is actually purified out to 97% because it's a very valuable natural milk-derived and colostrum-derived antiviral protein. So it's naturally secreted in colostrum and milk. And there's actually some at least one COVID trial going on right now that's looking at the impact of lactoferrin alone on COVID disease. So from Jenny Kennedy, about to go on to chemotherapy, likely to get more infected in a hospital. Do I take more colostrum? Keep taking colostrum. You might want to start sucking on Imifort or Varanox because it's in a tablet, and obviously COVID enters the body through the mouth or nose. So I think that definitely look to taking one of the 2 lozenge formulations that we have, being Imifort or Varanox. I can't answer Ethel's problem at the moment because this Lifeline has lots of other nutritious ingredients in it compared to colostrum. So that's a complex answer, and I can't answer it because stomach issues and Lifeline. But just reading this, when you consume yogurt, that's even more dairy. So you might be looking actually at a dairy allergy if it gets worse when you eat yogurt. From Elizabeth, with people with kidney stones and gallbladder stones, is it safe for them to take the AlphaLipid Lifeline and colostrum? Yes, absolutely. Gall and bladder stones are more associated with calcium and other minerals that are not taken in a food, right? They're taken just as a plain old supplement. So in the case of Lifeline, it is got supplemented with calcium, an essential mineral, but it's in a great big food matrix. So it actually goes into a different system in the body and it's not excreted. And colostrum, that poses no risk at all.
Thank you, Gill, and thank you